Great, I think we're going to get started. Thank you everyone for joining. My name is Todd Stack. I'm the General Manager of Medical Solutions for Henry Schein. And today we're talking about telediagnostics, remote care on par with a physical visit, made possible by MEDPOD. Very happy to have additional speakers joining us today. Jennifer Reynolds, who oversees the ISD programs for HealthPoint in Texas, which is a federally qualified health center. And Jennifer's been instrumental in the champion of MEDPOD deployment for her organization and the schools they serve utilizing MEDPOD. In addition, we have Ginny, the Chief Commercial Officer for Smartlink Health Solutions, an integral component to ensuring that MEDPOD connects to over 90 EHRs. So what is telediagnostics? I typically say if I ask 10 different people the definition of telemedicine, I'll get 12 different answers. MEDPOD is truly unique in that it truly brings telediagnostics to the provider's hands. So you can provide care in virtually any setting. This allows a remote provider simply using a browser to connect to clinical diagnostic equipment, the same equipment that's used in offices and urgent care settings, but control those devices remotely. They're not patient self-administered. They can be administered through a tech, a nurse, or a telepresenter to leverage the labor component. And we have a wide variety of case studies, some of which you'll hear today, that clearly allow MEDPOD to play a unique role in providing access to care, full bidirectional interface to EHR, and no need to rekey any data that actually allows you to bill for a level 5 E&M code, something you cannot do with a typical video visit. So with that, I'd like to introduce Jennifer Reynolds. Again, Jennifer is the director of the ISD programs at HealthPoint and FQHC and has been instrumental in deploying MEDPOD. So with that, I'll turn it over to Jennifer.
Thank you, Todd, for that introduction. Hi, everyone. My name is Jennifer Reynolds, and I do currently serve as the director of the ISD program and mobile unit clinics that we have at HealthPoint here in the central area of Texas. So as you can imagine, a very rural and remote area. I did recently receive my master's in public health, which has really been instrumental in being able to utilize MEDPOD and the functions that it has and offers to enhance our health program here at HealthPoint. So who we are at HealthPoint, we are a federal qualified healthcare center, as Todd said, and we serve underserved rural communities here in Texas through evidence-based healthcare. Our mission at HealthPoint is to strive to provide evidence-based healthcare utilizing patient-empowered team approach, resulting in individual wellness. And as you can imagine, being able to provide that empowered team approach with patients, their engagement is a true factor in whether or not they buy into the health changes that they need to make. And we also want to be the best place for patients to receive care, the best place for our employees to work, and the best place for providers to choose to come and practice medicine. How we delivered our care previously was through the traditional TMV visits, the telemedicine that everyone kind of got used to. As COVID approached, we became a little bit better at offering that functionality. However, we found that our patients in the rural communities really struggled with buying in to doing their medical visits when it came to chronic care management, or even, kiddos that got sick at school, of doing that visit through the traditional method with telemedicine. So with MEDPOD, as we looked at a way to engage with our community members to provide the best access, we chose to expand this by opening our school-based health centers. Currently, we have 8 school districts that we just now became under contract with here in the Texas area, and we are providing that care through the use of MEDPOD. And as you can see in this video, the pictures from videos that we did with our board members, our medical assistants are on staff at the school district, so we're only having to supply one team member full-time at that location to be able to provide the skilled services needed to do those visits. We're able to engage the families as well as the students or faculty that are having treatment done there in that actual treatment. And the imagery and everything that you get from MEDPOD has been instrumental in engagement of patients in their treatment. The imagery of kiddos seeing their eardrum for probably the first time ever in their lives, it has really engaged those patients in talking about their health, talking about their body, understanding how things work, and having the capabilities of doing that with MEDPOD has been phenomenal in our organization to engage our patients in their own care. It also brings flexibility, being able to have parents connect remotely into the visit and not have to readily leave work right away. So having that capability has been key in getting kiddos seen quicker in our school districts to be able to offer that care to keep them from missing a lot of attendance at school, and as well as for the faculty. They're able to get back to work sooner and not have to take off and wait to get into the doctor. And MEDPOD has been instrumental in making our organization's program functionable and being able to provide that care. So the flexibility we've seen with MEDPOD, we have different units that we're using from MEDPOD. So we have the Smart Power cart, we also have Streamline carts, and then we have one mobile dock that we use within our organization. The mobile dock we use in our rural clinics to provide a point of access of care so other providers in our organization can see patients, so that if a provider needs to be out for an extended period of time, whether that's for vacation or something happens health related with them, we still have that access in that clinic, and we can move that to any location that we need it in. And we've done that recently. Also, the Streamline cart that we have in our ISD locations, it really has provided the ability for us to provide the best care in the school districts. And also, we had an emergent need in one of our clinics where we had a school-based clinic, and we were able to send our facilities team over, load up that Streamline cart, take it to the clinic, set up, and never missed a beat for patients being seen in our brick and mortar location. We've provided around 2,700 visits. So if you think about the number of kiddos that end up missing school for 2 or 3 days because of not being able to get into a doctor, those visits have provided them the ability to get back into class, not miss as much school whenever strep throat's going around. We saw a lot of that, as well as some breaches of COVID happening in our school. So we were able to provide the care that they needed and get them back into class quickly.
Thank you for sharing that information, Jennifer. Really appreciate it. And you just had tremendous success in deploying in the school-based system. You've done a great job in the community. Before we get to Q&A, I just want to touch on a topic that's always the elephant in the room, and that's integration with your EHR. So working directly with EHR vendors on integrations can be expensive, time-consuming, and a heavy lift, without a doubt. Several years ago, we partnered with a company called Smartlink Health to help solve those challenges. Smartlink enables us to affordably integrate MEDPOD with your EHR in a couple of weeks versus a couple of months, with no EHR vendor involvement and no effort at all on behalf of your staff to be able to do the lift. So I've asked Ginny Mahaney, the Chief Commercial Officer of Smartlink, to join us today and give a quick overview of how Smartlink works. And with that, Ginny, I'll hand it over to you.
Thanks, Todd. And good afternoon, everybody. So just going to share a quick overview of what Smartlink is, just piggybacking on what Todd just shared. So it is a cloud-based integration solution. And when you think about integration, traditional integration using your EHR vendor or other integration partners, we do all of those types of integrations via API, HL7, or direct database. But the way we typically will integrate with an EHR is actually through the user interface. You can think about it like a software robot. So we essentially program a cloud-based robot to log in just like one of your users would, with a username and password. and navigate through the system to extract data and put data back in. So it does everything that a traditional integration would. It just eliminates all the time, complexity, and cost associated with traditional integration. Essentially, the user interface is an interface, so we use it in the same way that you would do a traditional integration. We just do it through the UI. Next slide, please. And you can build that out. Thank you. One more. Yeah, so the integration with MEDPOD, we program the software to log into the EHR and pick up all of the telediagnostic visits, appointments that have been created in the EHR, and send that and the demographic information over to MEDPOD. And then after the appointment occurs in MEDPOD, any of the information, vital signs, et cetera, that are captured during the MEDPOD encounter are then put back into the EHR. Next slide. So the way this works, first of all, there's no manual transfer of data from the EHR to the MEDPOD or back. There's no EHR vendor involvement at all. Somebody in the clinic just creates a user account for the software for us to program it, and that's it. There's no clinic effort in building out the integration at all. We typically complete integrations in 3 to 4 weeks, sometimes faster, depending on the EHR. And it's a very affordable way to do integrations. And with that, I'll hand it back to you, Todd.
Great, thank you, Ginny. And I would just add that, having over 90 integrations, over 90 EHRs that Smartlink integrates to, it really simplifies the process, not having to have the EHR host vendor having to be involved, and it does typically happen in less than 40 days. It's very affordable. The other key benefit there is it's a true bi-directional connection that's picking up scheduling as well as passing discrete clinical data. So just to go up about 10,000 feet here, just to talk about the MEDPOD platform in general. So I mentioned early on, if I ask 10 different people the definition of telemedicine, I'll get 12 different answers. Here you can see MEDPOD truly is a hardware software platform. The secret is the MEDPOD software. So we do video only visits. That's what most people think of when they think of telemedicine. And then we have hardware deployments from a backpack to the mobile dock to a streamlined power cart. Really depends on how and where you want to deploy. But all the clinical data and components we connect to, which we'll talk about in a minute, are all driven through the same user interface, where both the on-site provider and the remote provider have control to capture audio, video, clinical data, annotate images, and using Smartlink, all that data pushes back into the host EHR in the patient's actual record. Nobody has to rekey any of that information. That's extremely powerful, and again, leads to billing up to a level 5 E&M code. In addition, we have live translation services and other mechanisms, including a portable triage center to be able to deploy MEDPOD in virtually any location. Can you go to the next slide, please? So as I mentioned, right, the whole goal here is telediagnostics. So all the devices that you see in the center there, vitals, vision, PAC systems, stethoscope, retinopathy, et cetera, all of those are already integrated to MEDPOD. So typical deployment would have, vitals, stethoscope, exam camera, EKG, spirometry, et cetera, and then optional equipment. Those are all plug and play. So if you don't buy EKG as part of MEDPOD on day 1 and you buy it on day 91, you plug it into MEDPOD and it shows up as another device. The remote provider does not have to install any software. The only thing the remote provider needs is an internet connection and a browser. This allows you to leverage your most expensive assets, either mid-level or high-level providers remotely. They don't even have to be in the office. They obviously have to be licensed in the state where the patient is, and merely using a Chrome browser or an iOS device, they can control MEDPOD and capture all the video and clinical data, interact with the patient remotely, who's on with a either telepresenter, tech, or nurse, directly engaged with the patient. So in the example you see on the left, there's a tech engaged with the patient. The doc in the lower left actually turned on that otoscope and captured the inner ear image on his screen, and then annotated that image and is having an encounter with that patient well beyond a video visit. In addition to that, we connect to a wide variety of point-of-care lab diagnostics. So very powerful tool, without a doubt. So I would ask if there's any questions, if you would put them in the chat. I would also ask if that, we'll clearly be sharing this deck and information with all the attendees. And if you want to speak to a MEDPOD specialist, you can call or email either Lane or Tom, as shown on the screen. And thank you, everyone, for your time today.
Thank you, Todd, Jennifer, and Ginny. We do have a couple of questions, so we'll go down the list. First question is, how quickly can somebody expect to implement MEDPOD units, from equipment deployment to training, et cetera?
So I'll respond to that. From an equipment perspective, really typically less than 2 weeks to receive MEDPOD equipment. If you're doing an EHR integration, as Ginny mentioned, typically that happens in less than 40 days once we get the credentialing done. From a training perspective, I'll defer to Jennifer, but it's the same equipment that's being used in the physician office or urgent care today. Typically within less than an hour, people are up to speed on how to use the equipment, and then training the provider staff to make sure they understand their logins. Remember, it's all username and password driven, and you can see MEDPOD patients either via the schedule in your EHR or on an urgent care basis as well, and then add that information into your EHR on the back end. Jennifer, I don't know if you want to comment, since you've deployed in your facility, a number of facilities, and what you're taking.
Yes, absolutely. So I love to brag on MEDPOD. Our organization has had a phenomenal support system from not only Henry Schein, but also with MEDPOD, with Jackie and Lou and the team there. They have been instrumental in getting the training set up quickly whenever we've reached out and asked for that. It typically takes around 30 minutes for your team or your providers to train on the functionality of MEDPOD. Our providers, I have providers coming to me out of the woodwork within our organization wanting to join the school-based program because they see and hear about the use of MEDPOD, and it has just brought a transitional vision of what we can do with these units to provide the best care for our patients. So knowing that you have that support system from the vendors is truly phenomenal as a person out in the work, to know that you can pick up the phone and call them, or an email will be answered promptly. We've not entered any hiccups with that, and it's been a very smooth transition into getting our units up and rolling.
Great. So Jennifer, this one's for you. What would you say that your key takeaways would be from leveraging MEDPOD? And what lessons have you learned that you can share to help with any of the early hurdles?
So it really depends on the organization having a person that is going to take hold of the program and make sure that you're there to champion it. I have taken on this role after the program had already started. It was off to a very slow start, and we went from having 2 school-based clinics to the end of last year having 8 open school clinics. So it really takes someone understanding what this unit has to offer to their program and truly championing that program within their communities. And I believe we are even going to go with some of the travel options of MEDPOD on our mobile units to be able to use in our dentistry van. So we love these products. We know what they offer. We know the ease of the use of them, as well as the technology itself, what advancements it has to provide the best care. And so we truly feel that the way we used to do medicine has thoroughly changed, especially with the pandemic. And knowing that you can get to the patient where they're at is solely our mission in providing the best care to our communities. And so being able to take these travel units and go out into communities and provide care, it provides a whole nother access to care level, and you're leveling up for being able to provide that.
Great, thank you. Was there any pushback from either providers or patients when you had first launched MedPod?
I would be happy to speak to that one. Being in rural Texas, you have a lot of misconceptions about what telemedicine is. And so a lot of people thought of it as the traditional way. You're going to walk in, see a provider on the screen, they're going to tell you whatever about your care, and then you're going to walk away not really feeling that confident in what you were just told. And we've had parents bring their kids into our locations within the school districts and walk away blown away by the type of care that they were able to receive. And the fact that they were able to see the provider, even if they were remotely, they were able to see the provider in that remote session as well as their student sitting there with our medical assistant. So it gave a lot of comfort and ease. And we've also used that method in our clinics whenever we maybe have a geriatric patient that is in a nursing home and their family lives out of town, and being able to use the components that MedPod offers that we haven't found with other vendors. We did try another unit prior to MedPod, and it did not work sufficiently. And MedPod has exceeded all expectations as far as from being able to get people to buy into using the telehealth.
Okay, so next question. What is the structure of a telediagnostic care provider team? And this could be, I guess, a two-part answer. Maybe Todd, if you want to chime in, and then Ginny, I'm sorry, Jennifer, how does your structure look?
Well, it's Todd. I would just, again, defer to Jennifer. I mean, I think the important thing is to have a champion and be able to lift a program, right? So buying the equipment and getting the credentials and doing the EHR and doing the training is great. But, Jennifer clearly was that champion to move HealthPoint along from their former program and prior to our involvement where things were, I would say, stalled, for lack of a better term. It requires looking at things slightly differently. And again, getting the providers engaged so they understand the real benefits that this can bring, both from providing better care, better access, throughput, and also the labor components on the benefit on the expense side.
And so in our ISD location, we have one medical assistant at each location, and they man that clinic and do the registration. They handle getting the patients checked in, doing their vitals, and then connecting with the provider, making sure that everything functions and flows, and doing point of care testing and things like that in the clinic space. So if you really think about it from the component of in a brick and mortar location where you have a provider and maybe one or two medical assistants and front office, you're able to really build out a very vibrant type of situation, having one person be able to dually do both your front and back office, as well as having the provider remotely. So they're still able to see patients in a location or other virtual visits using telediagnostics. So you're actually upping your game and lowering your overhead cost as far as staffing.
Great. And then we have a two-part question. Can the system capture real-time diagnostic data that connects into your EMR? And then the same person, does the system allow you to provide virtual episodic care?
Yes, to both questions. So yes, we are capturing the data directly from the devices that I mentioned before and passing those readings to the EHR as discrete data via Smartlink. Yes. The other thing I just quick comment on is in many cases, people think of MedPod solely for the use of rural health. I can tell you we have lots of success stories, both in rural and urban settings. One of our most successful case studies involved Metro New York taking care of special needs patients and reducing the incidence of them ever going to the emergency department by 86%, millions of dollars in savings. Unfortunately, those folks had typically, before MedPod, would wind up in an ambulance to the emergency department and be admitted 50% of the time. Using MedPod, we reduced that by 86%, and they got care directly in their residential group homes, as well as other metro areas in Orlando, Florida. We have a capitated doc that has 2 offices, has over 3,500 patients in his panel, sends his tech out with a mobile doc in a van every single day to keep his high-risk patients from being admitted or readmitted. That results in providing better care, preventing those admissions and readmissions, and bonus payments from the payer for providing that level of care. So when you think of MedPod, don't think of just rural care. Clearly, it provides extraordinary benefits there, but it can really be used to provide access to care where some of the basic mechanisms are broken, and that includes Metro New York and other metro areas.
Great. And to finish up, there are a couple of questions regarding pricing and price information.
Yeah, so I would ask anybody to reach out to the specialists that are shown on the screen. Again, when you're comparing MedPod, you're not just buying a bunch of equipment. It's really the software that makes the difference in how you deploy. So there is an initial investment. We do offer leasing programs as well. So whether you're using grant dollars, leasing programs, or outright purchase, we're here to help you facilitate that and configure MedPod how it makes the most sense for you. And I would also add, as Jennifer mentioned, in many cases, people start out with a single unit and grow. One of our largest customers has over 60 MedPods. They started with a single unit 4 years ago, and now they have close to 65 units.
Great. Well, thank you to our speakers. Thank you for everybody who gave their time today. We hope this was insightful. We'll send this video presentation out by Friday, along with a couple of case studies that Todd was alluding to and some more information to give you a deeper dive on these different products and where they could be applied. So thank you and have a great day.